Welcome to the National Coalition website. Our organization was formed as an advocate for patients, physicians, and those in the medical field, pharmaceutical and device manufacturers, to better aid the consumer in their desire to get proper screening for colon cancer. We feel that colonoscopy, done in a timely fashion, is certainly the most effective tool, the gold standard to prevent colon cancer. Unfortunately, certain barriers exist to getting patients in a timely and cost-effective fashion, and our organization is dedicated to allowing patients to use the most effective tools available to prevent this dreaded disease. We have been committed to making sure that patients get colonoscopy in a proper setting, in a setting that can be done at the minimal cost and yet providing the most advanced instrumentation and the most advanced anesthetic techniques. We're trying to remove barriers that sometimes are put up in insurance companies and allow people to have these procedures done as a preventive procedure. We're also trying to minimize co-pays so that these are done as part of a wellness care. In addition, we want to get the information out there that this is a very cost-effective procedure, that the actual cost of the procedure has come down dramatically over the past decades, and that this is something that everybody should afford as part of their health care. Our organization is committed to helping consumers in every facet of colon cancer screening. We also need to be aware that this screening should start at age 50, and for certain segments of the population that are at higher risk, such as those with family members that have colon cancer and African Americans, the procedure should start at age 45 or even younger, depending upon when the disease first occurred in the family. This is not well known by much of the population, and we're trying to educate primary care physicians as well as consumers to begin screening at these young ages. Another part of our organization that we're focused on is understanding the true cost of missing colon cancer diagnosis. The chemotherapeutic agents that are used today, if colon cancer is diagnosed late, are dramatically expensive, which makes the cost of each missed colon cancer something that weighs heavily upon societal medical cost. If we can reduce the number of missed or late diagnosed cases and reduce the need for these very, very expensive chemotherapeutic and other therapeutic modalities that are applied later in the course of colon cancer, we can save millions and eventually hundreds of millions of dollars in healthcare costs. These savings can then be used in a more preventive or prophylactic fashion, which we feel is a much better use. The cost also of human suffering will be greatly reduced if we can find colon cancers early and prevent colon cancers. Those are just some of the facets of our organization and some of the things we want to address on our website.